If this happens to you, you have to try a different hearing aid. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 289, and today I want to talk to you guys all about trying to find the best hearing aid for you. But before I get into it, do me a huge favor, click the like button, really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So what is prompting today's vlog? Well, the reason that I'm talking about finding the best hearing aid today is because I had a patient that I've been treating for about 6 weeks at this point, and nothing really has been going well with her treatment. Now, everything should have gone well based on all the information that I was able to obtain at the consultation visit and everything that I identified during the fitting of these particular hearing aids. But we were running into some issues with the left hearing aid not being super comfortable. We made some modifications, we requested a remake, so on and so forth, but ultimately the physical fit just hasn't been great with these custom in-the-ear hearing aids that are rechargeable. The other thing that just hasn't been going well is her overall performance with these hearing aids. Outside of the physical fit issues, she just felt like she wasn't getting the type of performance that she wanted with these hearing aids, and I honestly had to agree with her. So one thing that hearing care professionals who follow best practices do is they do a validation outcome measure. And because our best practice fitting sequence is over the course of 45 days, at that 6-week visit that we have someone come in for, we essentially go through this validation outcome questionnaire. I happen to use the COSY, which is the client-oriented scale of improvement, but inside of the COSY, we have a variety of different situations that the patient uses to subjectively identify how much benefit they're getting in those situations with their new hearing aids. And this individual was reporting no different to slightly better in virtually all of her listening situations. And anytime that I see that, I'm like, okay, is this person someone who has a profound level hearing loss with like 30% word recognition, or is it someone who has better word recognition than that and they're just not doing well with their hearing aids? Well, this particular individual had 88% speech understanding, which would lead me to believe that at least in quiet environments that she would not be having issues understanding speech. And she was reporting that she wasn't getting much benefit. Now, this can be due to a few reasons. Number one would be the improper programming of the hearing aids, meaning you didn't follow best practices when following a programming protocol and performing reader measurements, so on and so forth. I had done all of those things, so we pretty much ruled out any issues when it came down to the baseline programming of the devices. The other side of it could be that the expectations of this individual are completely off. But how do you identify if this person is just at their maximum hearing capacity with the hearing aids that have been programmed properly for her, or if she truly could get better benefit with a different pair of hearing aids? And this is where I typically recommend patients switch to something different, because here's what we don't want to have happen. We don't want to have this individual who's only getting a slight reported improvement with her hearing aids to have to be stuck with those hearing aids for the next 5 to 7 years, which is the typical lifespan of a pair of hearing aids. Besides, I don't want her coming into my clinic every 3 to 6 months saying that, yeah, I wish I wouldn't have got these devices from you because they're really just not doing that well for me. So instead, what I usually recommend is going with a completely different hearing aid brand. And because I work with a lot of hearing aid brands inside of my clinic, I can pick from basically any other hearing aid manufacturer that I want to. So what we did is that we tried to identify what is the hearing aid that has all the features that she wanted in the hearing aids that she originally got, but in a completely different brand that processes sound differently. So what we did is I encouraged her to say, hey, you know what? I don't think that we should continue on with these hearing aids that I fit on you 6 weeks ago. What I'd like to do is order a different pair of hearing aids, fit you with those hearing aids, and then put you through another evaluation sequence to determine if your performance is better. Now, one of two things is going to happen with this. Number one is she's going to end up doing substantially better with these hearing aids, and we're going to fit them and program them in a very similar fashion that we did with our first pair of hearing aids, but because every hearing aid manufacturer processes sound a little bit differently, she may actually perform better with these new hearing aids. That's the first thing that could happen. The other thing that could possibly happen is that she tries those hearing aids and she's like, you know what? I feel like my performance is basically the same as what it was with the first set of hearing aids. And what that would tell us is that her expectations are off. Now, as crummy as that sounds, if we go through a comprehensive best practice protocol like we do on our Applied 360 fitting sequence, then we know that the hearing aids that she's wearing are programmed properly and have been optimized for all the situations that she wants to hear better in. And if she is still not hearing as good as she wants to hear, it's because it's literally not possible. Now, I hate to say that because I want everyone to be feeling like they are hearing their absolute best. It's just unfortunate that someone individuals, when they are hearing their absolute best, is not as good as what their expectations were. Now, we still do not know the outcome for this individual patient, and I will be updating you on this in several weeks from now after I have fit this individual with the new hearing aids. I've gone through the entire fitting protocol, and we've had a chance to do validation outcome measures again. But I want to hear from you. If you've purchased a new pair of hearing aids and you don't feel like you're getting the amount of benefit that you should from those devices, especially if it's been validated in an outcome measure of your performance, what do you do? Do you end up returning those hearing aids for a refund and going somewhere else? Do you end up just sticking with those hearing aids even though you don't like them for the next 3 to 5 years? What do you do? Let me know down in the comment section.